everyone, I am Monica de Guzman, a student nurse from Davao Doctors College, BSN 212B. And so for today's video, I'm going to do a demonstration on how to properly assess the Leopold's maneuver. Leopold's maneuver is a palpation of gravid uterus systematically. This method is easily performed and non-invasive, and it also to determine the position, presentation, and engagement of the baby inside the uterus. So without any further ado, let's get started. So prior to perform the Leopold's maneuvers, first we have to do a thorough medical hand washing to avoid cross-contamination and to avoid getting any microorganisms. Second, we have to explain the procedure to the patient. Hi ma'am, I am Monica de Guzman, your student nurse for today. And so for verification, may I ask what is your name? Okay, your birthday? Okay, so let me explain to you the procedure or the assessment that we're going to do right now. So we're going to do a Leopold's maneuver, which means that we're going to determine the position, the presentation, and the engagement of the baby inside, or the baby or the fetus inside your womb. Will that be okay? Okay, thank you. So right before we start our assessment, let us allow the patient to do to empty her bladder. So, ma'am, if you want to urinate right now, before we start, it can avoid the discomfort throughout the assessment. So you can urinate, ma'am, before we start. Okay. All right. Thank you. First, we have to position the patient into a supine position, and then we're going to provide a pillow under her head with the knees slightly flexed. Next, also, we have to provide a small pillow to put her on her back. Next, if it is right-handed, we have to stand on the right side of the patient. To perform the first maneuver, we have to palpate the uterine fundus. It is to determine which part of the fetus lies in the upper part of the uterus. And I have to form a triangle of my hand. Next, for the second maneuver, we have to palpate downward of the sides of the abdomen. We have to determine the fetal extremities, the fetal back, and the anterior shoulder. And of course, to perform that, we have to my left hand will be stationary, and then my right hand will be moving. And after that, my left hand will be moving, and my right hand will be the one we're gonna be stationary for a moment. So when performing the third maneuver, we have to put one hand on the over the symphysis pubis. It is to determine the engagement of the fetus. So if note that if it is movable, the fetus is not already engaged, and if it is not movable, the fetus is already engaged. The first, second, and third maneuver is we're facing the face of the client. Now, in the first maneuver, we have to stand and facing the feet of the patient. So we're going to perform the fourth maneuver to determine and to confirm the third maneuver. Next, we're going to locate again the location of the back of the fetus, and we're going to use the stethoscope to get the fetal heart tone of the fetus. We're going to do this in 1 full minute. we have to locate the location and the fetal heart tone of the fetus. Next is that we're going to position the patient into a comfortable position, and then we're going to document the fetal presentation, the attitude, and the engagement of the fetus inside the uterus. And when you're done already for this assessment, you have to do a thorough medical hand washing.